This video will cover type 2 diabetes, so also looking at what happens when glucose homeostasis goes wrong, but it's slightly a different way this happens compared to type 1 diabetes. So in type 2 diabetes, and it's still called diabetes mellitus, there is plenty of insulin around for the most part, but instead of the cells being able to react to the message that the insulin is telling them, these cells they either lack receptors, which means that they are not able to respond to that information, or another possibility is that their receptors are damaged in some way, or they are a slightly different shape, so they are not responding to insulin correctly. There is an intermediate step before developing type 2 diabetes, and this is related to the sensitivity of these receptors to insulin. So there is like an intermediate range that means that you are becoming less sensitive to insulin. This is known as insulin resistance, and it is normally a precursor to type 2 diabetes developing. Type 2 diabetes is the most common form of diabetes, so there's about 90% of all cases, and generally this does not occur in early childhood, so this tends to be adult onset, and that was the original term that was coined for it, so adult onset diabetes, generally occurring in people who are over 40, and it is highly linked to obesity. So people that are overweight are at much greater risk of developing type 2 diabetes. The symptoms are very similar, but they can actually be a lot milder compared to type 1 diabetes, and they come on quite slowly, and so what that means is that the disease often is undiagnosed, and therefore it is also unmanaged. So that means that a lot of these people are not managing their high blood glucose levels, and these are the people with type 2 diabetes that are more likely to end up with these really serious side effects that we talked about in the last video, like retinopathy and nerve damage and kidney damage and gangrene and self-amputating toes and things like that. This graph is just showing that, generally speaking, type 2 diabetes tends to be more prevalent in an older population, so very, very uncommon in young people, and more often than not, this little group down here would tend to be very overweight or have other health problems going on as well. So yeah, peak is sort of in your sort of 60s and 70s. It is interesting to note that we actually have different rates of diabetes in different ethnic populations, and the highest rate is actually in Pacifica people, as well as Indian, and then you can see Maori is down here and European is down the bottom. So it is possible that this is related to some kind of genetic predisposition. It's definitely sort of a inheritable disorder, that something is going wrong with these insulin receptors. But it's also possible that this is somehow related to diet, and perhaps even a general sort of obesity levels within these populations. So just a bit more detail about what actually causes type 2 diabetes, and this is definitely insulin resistance, and so insulin is still there, but it is just that the body is not responding to it, and as we said previously, this initially is called insulin resistance, but over a period of years this can actually get worse and worse, and then full-blown diabetes is actually diagnosed, remembering that they are still using this fasting blood glucose levels in order to diagnose diabetes. You can see in the image here, this is normal insulin response for a cell, and so insulin is here. Don't pay too much attention with the way they've drawn this because it's a little bit misleading, but basically insulin is here. You can see there's a very specific shape to this insulin protein, and this is obviously just schematic, but this binds in and is able to link to these receptors that will then stimulate the uptake of glucose. And if you compare that to an insulin resistance model, these insulin receptors on the surface of the cell are not the right shape, or they're not there at all, or they're just not functioning properly. And so even though the insulin is here, it is not able to tell the cell to uptake glucose and therefore reduce it and take it away from the bloodstream. And as we've said as well, one of the major causes of type 2 diabetes developing is obesity, and this is partly because you can actually end up with lipids being carried around in the bloodstream, and this also can react with the hormones and stop these cells from being able to respond to insulin. This is just talking about another cause, which is genetics, or basically your likelihood to inherit this off your parents. And it's true to say that not all people with obesity or even insulin resistance actually go on and develop full-blown diabetes. And recent studies have shown that there are some people that are predisposed or more likely to have some kind of defect in their beta cells. So while we've been talking about type 2 diabetes being caused by defective insulin receptors on cells of muscles and fat cells and liver and things like that, long term there does also become a problem with the beta cells, and the insulin production does change slightly as well. So this diagram is just showing that it's not just genetics, it's not just a lifestyle factor that results in type 2 diabetes. There is obviously some kind of combination here of the two of them that causes it. What this does hint at is that you obviously can't change your genes, but what you can do is you can change your lifestyle factors, and we'll talk about this shortly, but a lot of people manage their diabetes simply through changing their diets and changing the way that they're exercising and looking after themselves. Okay, there's quite a lot of information on this slide, so don't get too stressed about it, but I put it in just to show you that type 2 diabetes is a process of developing, so you don't just immediately go straight into type 2 diabetes. There is all these factors that occur before you actually end up there. So at the very beginning, we've talked about this, there is some kind of genetic predisposition to develop this, as well as having some environmental factors like a poor diet and lack of exercise and things like that. Over time, these people develop insulin resistance, so their body stops being able to respond to insulin, and they will get a buildup of glucose. The next stage here is IGT, which stands for impaired glucose tolerance, and that is like the next step in this pathway to type 2 diabetes. And it's after this step that they actually diagnose diabetes properly. So if you have hyperglycemia, remember that's high levels of blood sugar in circulating. If you have that over a long period of time, these are some of the diseases that can develop, or the symptoms that can develop, and we've talked about them previously, but basically we consider them to be complications of diabetes. Eventually these will become so severe that they cause the person disability. They stop becoming a productive member of society. Their life is taken over by these symptoms of the disease, and eventually they will end up dying from it, which is not very pleasant. But it's the idea that this is a process, and at any point, even within here, people are able to manage their diabetes, and we'll talk about how they do that. The main form of treatment and the main line of defense, or the first way that doctors respond to patients being diagnosed with type 2 diabetes, is basically to get the patients to reduce their weight. And so that could be through reducing their food intake, as often overeating is part of the problem. And also, recommendation is to exercise. And we're going to talk shortly about why exercise is so vitally important in terms of glucose regulation. I'm not going to talk through this information now because I've got a couple of slides that do it in a much better way, but needless to say, exercise is really, really vital in terms of getting your body to absorb glucose. So diet and exercise is the main treatment for type 2 diabetes. Okay, so this is the mechanism that exercise plays, or how it allows our body to take up more glucose. So you might recall that we looked at this image on the previous videos, and so this is the same kind of image. This will be a muscle cell. So the important thing to remember is that these are not fat cells, these are just muscle cells that exercise can apply this to. And so what happens is that the process of exercising in itself, even in the absence of insulin, will stimulate a response where these GLUT4 transporter proteins can be transported up to the surface of the cell, and they will be expressed there and upregulated, and they are therefore able to absorb glucose into the muscle cells. And so this is a really important way of reducing high blood sugar levels, because just by exercising you can upregulate these GLUT4 transporter proteins, and you can take the glucose out of your bloodstream into the muscle cells so that they are able to use them up. Let's just have another look, and we'll flick through and see that process happening. So exercise stimulates this vesicle that contains these GLUT4 transporter proteins. And now we can see that the vesicle is undergoing this process of exocytosis, so it's traveling up to the cell membrane and taking these GLUT4 transporter proteins with it. And now it's joining in with the cell membrane, so you're starting to see these GLUT4 transporter proteins being expressed on the surface of this muscle cell. And finally, we've got this high expression now of these GLUT4 transporter proteins so that they can uptake glucose from the bloodstream into the cell itself. So that's a pretty cool mechanism. And so it's good to know too, even if you take in a whole lot of sugar, or you think, oh, I've really eaten too much today, I've taken in too many carbs, and your body is trying to break all this glucose down, going out and exercising can stimulate the uptake of glucose. So it is so important to exercise every day. So secondarily to diet and exercise, there is another line of defense, and this tends to be reserved for people that either haven't been able to reduce their weight, or the insulin resistance is not responding well to that. I'm not even going to attempt to say these names, but you guys can read them. But basically these drugs, there's a class of drugs that can increase the amount of insulin in the circulation. And so even though these type 2 diabetics normally have enough insulin in their body, if you ramp that up a little bit more, possibly you will allow, just by having greater number of insulin molecules there, you might end up hitting a few more of those receptors that are still present. Secondly, another drug here which can actually improve insulin resistance as well. And finally, if the beta cells degrade so much that they no longer are producing adequate amounts of insulin, then the type 2 diabetics can inject themselves with insulin. But remember that generally this is not the problem. It is insulin resistance. So these receptors are not responding to insulin, rather than there being an absence of insulin. We've talked about these previously, but just a quick reminder about what some of the symptoms are. And often in type 2 diabetes, because these symptoms develop over a long period of time, people can live with these kind of things without it actually being officially diagnosed. But there's just a few here. You guys can read through these. But a lot of these things in older people, things like wounds taking time to heal, can be very debilitating for them. And also getting tingling in hands and feet and some of these other things. And for a lot of older people, some of these symptoms might be happening anyway in their bodies that might not be related to diabetes. And so it's very difficult for them to understand that this is a diabetic-related symptom that they could actually improve by taking some steps to manage their disease. So as I mentioned previously, it's still important in order for a proper diagnosis to take place that people undergo this fasting blood glucose level. So once again, you fast overnight, and then what actually happens is that these people drink an oral glucose load, which is this super sweet drink. And then what happens is you let the people drink that, and then you have a couple of blood tests in those times following that, and you can actually check and see how people respond to the spike of taking in this glucose. They actually do this in a lot of pregnancies, and in my second pregnancy, I ended up having to take and it's called an oral glucose tolerance test. And simply because my first baby had been a large baby, and that is also indicative of diabetes developing during pregnancy. And this drink was so super disgusting. It was awful, but really, really, really sugary sweet. And then you get this massive big sugar rush into your body. So it's very hard sitting in a waiting room trying to read a book while you've got all these little buzzy glucose molecules buzzing around your body. Regardless of that, this is what some data looks like of people that have different types of responses to taking in a glucose load. And this can be very important in terms of diagnosing what somebody might have. So this green line down the bottom is the normal glucose load, and so you can see that somebody that takes in glucose will secrete insulin. The insulin causes that glucose to be absorbed into the body cells, therefore decreases, and will come back to a resting rate pretty much within a couple hours. So it actually happens reasonably quickly. If you're insulin resistant, you do come back down to normal, not quite normal. You can see the fasting levels are slightly higher, and it's simply because your body is taking longer to respond to the insulin that has been secreted. Type 2 diabetes, your resting level is higher to start with, and you do take a longer time to respond to come back down to that resting level. So in this graph, it's showing you about over 3 hours to get back down, simply because your body cells are not able to respond to any insulin that is present. Type 1 diabetes, much higher resting or fasting level because there is very little or no insulin at all, so you have a sustained high blood glucose, big peak, and then it takes a really long time to come back down as well. Just a bit more information on this graph. So we said this already, but you can see that these three people or pieces of data, insulin resistant, type 2 and type 1 diabetes, will all have elevated fasting glucose levels. So that is a first sign that something is not quite right. And you could say that these people were basically glucose intolerant. The second thing they do is they take a blood test at 2 hours after you have consumed this glucose load, because if you are regulating glucose normally, your blood sugar will be back down to your fasting level, but in any of the other three cases, it will still be very elevated. So look at this one up here, type 1 diabetes. It's much higher than it was at the fasting level. Same with type 2 diabetes here as well. Just a brief note, so OGTT is oral glucose tolerance test, and that's this test we've just been talking about. A couple of pieces of information. So type 1 diabetics, very high blood glucose levels from fasting because there is no insulin there. Type 2 and insulin resistance have a little bit of an ability to control blood glucose, but it is very impaired, so it does not match up with what a normal response curve would look like. A little bit of information here. I really don't think you need to know this, but this is just some data or some random points here that are kind of like diagnostic tools in order to diagnose you as having type 2 diabetes or diabetes at all. But it's important to note that even though we've got these numbers here that sort of mark as a set point for whether you are developing this disease or not, if your blood glucose is still normal than it should be, that can still be causing some damage. You definitely don't need to know this information, but it's a little bit of extra stuff that you might find interesting. I'll let you read through this, but basically they've been finding recently that gastric bypass surgery, and so this is surgery where removing part of the stomach or all of the stomach, and people often undergo this as a radical way of losing weight, but they've actually found that as well as causing weight loss, this can actually be used to treat diabetes as well. That is not just related to reducing weight, if that kind of makes sense. So it reduces weight, but even before it makes them lose weight, they do start responding better to it, and their diabetes starts becoming a bit more under control. Also, you do not need to know this, but interestingly, there are different, I didn't even know this, but there are different types of bypass surgery, depending on how much of the stomach they're cutting off, or if they're just reducing the band or the size of the stomach. But different methods have different effectivenesses in bringing about a reduction in diabetes. this could be an area of research for you. So I cannot expand on these ideas at the moment, but it's certainly an interesting idea. And a final few sort of ethical, social-minded questions. So as obesity is becoming much more common, how are we going to deal with it in our society? Because this could become a very costly issue for us to have to deal with. Should we make PE compulsory? Should we ban McDonald's? Should we tax fast food? How much do you actually need to eat extra each day in order to get fat? And so there's a horrible information down here about eating only one extra French fry a day. But the point is, what are the social impacts of this? So how are we going to deal with this in our communities? Something to ponder for you. Okay, just 2 quiz questions from the video this time, but the first one's reasonably long. So the first thing I want you to do is to write down how type 2 diabetes is actually different to type 1. So you could think about things like what mechanisms are taking place that make it different. So thinking about the role that insulin is playing. You could also think about the age group that it affects, and maybe also how it is treated. And finally, a bit of a double up, but the last question, what are the main treatments for type 2 diabetes? Okay, so pause now, write down your answers, and then we'll go through those together. So type 2 diabetes, the main difference is that it is the insulin receptors that are not working, as opposed to no insulin being secreted, which is the case in type 1 diabetes. Type 2 tends to be adult onset. Type 2 is related to obesity. And another interesting thing is that type 2 diabetes is much more easily managed. So you can do that, as we'll talk about in a second, through just changing your lifestyle. Whereas type 1 diabetes, you need to inject insulin. There's no way around that. It's also less severe, so the symptoms may not be quite as acute or severe as those of type 1. The main treatments, diet and exercise, so reducing weight, but remember that the exercise also responded to upregulation of those GLUT4 transporter protein, so that was so important. As a second line of defense, they could also have used drugs to treat it, and then finally injecting insulin if it comes down to it.